We now jump into a discussion of how to distinguish qualitative from quantitative approaches to health research. My apologies if you've covered this information before. Quantitative research. Quantitative research uses numeric data, so it's using numbers, sometimes to test a hypothesis, though not always, not exclusively. Data is analysed using statistical methods. In fields such as endocrinology, which is a field in which I work, it's really useful when practitioners want to measure the effectiveness of a new treatment option. So they measure it in a quantifiable way and they compare across two groups. For instance, the measuring of changes in breast growth when comparing two different forms of estrogen treatment or estradiol in transgender women. Here you would quantify the different doses across the two groups and then compare the different effects in terms of rate of growth, which is something that you can measure. Data can be collected by way of direct measurement, for instance, blood test results, certain levels of hormones in someone's blood, reaction time measured in seconds, or growth in centimetres or millimetres, or by way of surveys where data is converted into values or numbers. In contrast, qualitative research yields narrative data. So instead of using numbers, we're talking about people's reflections, statements, text-based excerpts. Qualitative research seeks to centre the voices and realities of individuals, or people, or groups of people. The focus is on the situated and subjective experience of a particular phenomenon or topic. It's often used to develop theories and inform actions. Sometimes it is the exploratory research upon which standardized inventories are then developed and later measured using quantitative methods. Data is usually collected through interviews, for instance, in-depth interviews, which can be semi-structured or unstructured, though there are an array of other methods, including photo voice, mixed media diaries, or observation. This is important in terms of preparation for your upcoming quiz. Quantitative research usually tests a hypothesis or a theory, but not always. Qualitative research usually contributes to build a theory. Okay, I want to step into an example of how qualitative and quantitative research can approach the same research question. So to demonstrate the utility of quantitative research, to demonstrate the utility of qualitative research, which is the kind of research that I use, I want to speak about my experience of doing a literature review recently. My research is about trans and gender diverse adults. I'm defining trans and gender diverse people here as people who do not identify with the gender assumed based on their sex assigned at birth and may access medical, surgical, and or social avenues to express a gender that feels more livable to them. There is a lot of research that documents the health inequities of trans and gender diverse people. This is a community that is more likely to experience mental illness, violence, unemployment, homelessness, and suicide. But I wanted to shift the focus from one of risk to one of resilience. What is it, I wanted to ask, keeps people alive? Social support, which is something we discussed earlier, is a determinant of health. People who have more comprehensive social networks tend to live longer, they recover quicker from disease, they rate their mental health more highly or positively than people who are isolated. So I started looking at both qualitative and quantitative studies of the social support experiences of trans and gender diverse adults. Here's an example of an Australian study. What they did in this quantitative research piece is they asked transgender adults to reflect on how well they feel supported by their families, their friends, and a significant other. So 3 domains of social support. They then converted these self-reported values into a single numeric value for each participant. They then performed a statistical analysis that enabled them to look at how social support related to depression. They sampled 243 mostly white, trans, and gender diverse adults. What they found is that higher perceived social support was associated with lower self-rated depression. Or, put another way, the more social support you have, the less likely you are to feel depressed. This is a cross-sectional study, so we can't talk about causation, we can only talk about associations. So we have some evidence that social support is aligning with the stress buffering model that I spoke about earlier. And this evidence comes from this research paper, which is a quantitative research piece. But when we look at qualitative research into trans experiences with family, we begin to see something else. In a second study on screen, this is a qualitative study in which 20 adults were interviewed for around 1 hour each. An interesting finding was observed. Experiences of family rejection are really common among trans and gender diverse people. What this suggests is that the practice of creating a single numeric value, a quantifiable measure of social support across 3 domains, and if you recall, they were family, friends, and a significant other, obscures a very important phenomenon, and that is, perhaps, for trans people, support from families is not the main source of support. By holding up both the quantitative and qualitative research findings, I was able to find a gap in the existing literature and knowledge base. That is, we need to firstly understand what social support looks like to transgender people. We need exploratory, inductive, qualitative research. So my research is about asking people to describe, without parameters, without sectioning off of experiences, what is socially supportive to you. But you'll be hearing more about this research as we progress, particularly in discussion of the social determinants of health. Okay, so to end this first lecture from week 1, we have 5 case studies. These are examples of research, and the task that you're presented with is to determine whether this is an example of qualitative or quantitative research. Okay, I'm going to read through each scenario. I'd like you to then pause the video and take some time to reflect. Please record your answers, and we will discuss these during our first class next week. Okay, question 1, qualitative or quantitative? A physiotherapist examined patient records in order to determine if there was a difference between AFL footballers' recovery time from musculoskeletal injuries when treated immediately versus a delayed start to treatment. Feel free to pause the video here. Question number 2. Again, is this qualitative or quantitative research? A speech therapist conducted surveys to determine some of the reasons children and their families ceased treatment sessions and summarized the comments made. Moving on to the next scenario. Question 3. A paramedic educator recorded the number of graduate ambulance paramedics as a percentage of the total that failed their scenario assessments with the aim to determine the need for further education sessions. Question number 4. A pharmacologist measured the differing levels of a particular antidepressant drug in patients' blood to determine at what level this drug caused the side effect of memory loss. Again, is it qualitative or quantitative research? And our final scenario. A mental health nurse observed schizophrenic patients participating in a dance class and recorded their oral accounts before and after the sessions with the aim to explore the benefits of such a program. So this concludes our first lecture, which provided an overview of the scientific method and also a discussion of some key terms, some key terms that go into your glossary of terms, and the distinction between qualitative and quantitative research.